afternoon everyone. So I'll be presenting a comparative study. Is scoliosis correction with O-arm imaging system and stealth station navigation better than freehand technique? In surgical scoliosis correction, freehand pedicle screw insertion technique is challenging due to three-dimensional deformity. The O-arm 3D imaging with navigation system is reported to be more accurate for screw placement and to reduce radiation exposure to surgeon. Between December 2017 and July 2021, 14 patients underwent posterior spinal instrumentation for spinal deformity correction using O-arm imaging system and stealth navigation system. An intraoperative CT scan of the sterile surgical field was obtained before instrumentation. Instrumentation was placed and a post-instrumentation CT scan was obtained before wound closure to assess the accuracy of instrumentation placement and the potential need for revision. A comparison group of 15 patients who underwent scoliosis correction utilizing fluoroscopy and a freehand technique during the same period was evaluated. The parameters were age, accuracy of pedicle screw placement, effective radiation dose, and the deformity correction. This is an intraop imaging showing the freehand technique. So this is a case of scoliosis with a knot Chiari malformation in a 14-year-old female. The clinical pictures, post-op pictures. So these are the images where the correction was done using O-arm guided technique. So case 1, where the syndromic scoliosis correction of 140-degree curve in a 15-year-old male. Post-op exercise, final correction. Case 2, syndromic scoliosis correction with 65 degrees in a 14-year-old female. Final correction. Case 3 with 67 degrees of scoliosis curve. Final correction. So the results, statistically significantly, there was less breach of pedicle wall in the O-arm group as compared to the freehand group. The average radiation to the patient was greater in the O-arm group than the freehand group. The radiation dose to the surgeon was minimal in the O-arm group as compared to the freehand group. So the average age which we consider were of 14 years plus or minus 2 years. So our results were consistent with other studies where the misplacement was lesser in the O-arm technique as compared to the freehand technique. So in our study, there was significant less radiation to the surgeon in the O-arm group than in the freehand group. However, radiation exposure to the patient was significantly higher in O-arm group than in the C-arm group. Similarly, Zing et al. Reported higher radiation dose to patients in O-arm group than in C-arm group, though the statistical difference was not significant. They also reported significantly less radiation exposure to surgeon in O-arm navigation group as compared to the freehand group. So we concluded that the use of O-arm with navigation system increases the accuracy of pedicle screw placement in patients with scoliosis, significantly decreases in radiation exposure to surgeon, but higher radiation exposure to patients as compared to the freehand group. The magnitude of scoliosis correction was similar in both the groups. Accurate placement of both the screws and increased density of screws might result in better correction of the curve, but this has to be proven in a larger number of patients. These are references. Thank you.